Hello, as part of our Global Health Action Research Pitch 2025, I present to you our research study, ADAPT for Adolescent Health. This study aims to understand system adaptation measures for effective implementation of the adolescent friendly health service policy in the Philippines using a participatory action research approach. Before I dive into the details of the proposed study, a little bit about us. I'm Ilham and I'm the principal investigator for the study. I'm a medical doctor and student of public health from India, and I'm presently pursuing my master's in public health from the Institute of Tropical Medicine, Antwerp. And with me is a very diverse and experienced research team from across the world. So, why is adolescent health important? Well, the period of adolescence is a distinctive period of physical, psychological, and physiological development. During this time, the increased risk-taking behaviors of adolescents make them extra vulnerable, necessitating access to quality adolescent-friendly health services delivered by trained professionals. In the Philippines, 21.5% of the country's population is comprised of adolescents, and the adolescent health statistics are rather dismal. 1 in 10 young women aged between 15 and 19 is already a mother. 16% of abortion attempts occur among teenagers. And despite Philippines having a policy for adolescent-friendly health services, the statistics continue to be rather dismal, which makes us wonder that there is definitely a problem and research gap, and hence the need for the study ADAPT. So in 2016, the Adolescent Health and Development Plan was revised in order to provide comprehensive, coordinated, and integrated health services to adolescents, putting the responsibility on local government units for ensuring system adaptation measures were put in place for implementing this policy. However, it is well established that challenges in system preparedness to integrate this policy across dimensions of health, education, and legal protection and social welfare continue to exist, but these challenges are poorly understood. And therefore, we wish to answer the burning research question of how effectively has the Philippines health system adapted to implement the adolescent-friendly health services model across its provinces through our ADAPT study. We have three main objectives. One is to identify the key system adaptation measures for implementation of the AFHS model adopted by the local government units of select Philippines provinces, to evaluate the effectiveness of the present system adaptation measures in ensuring integrated, coordinated, and comprehensive AFHS delivery, and to develop comprehensive recommendations for improved system adaptation and policy coherence measures based on the gaps and challenges identified during the course of the study. The study is based on an adaptation of a conceptual framework from Rifat Atun in 2009, and through which we want to look at analyzing integration of the AFHS model into the general health system of the Philippines within the broader context of the country itself. And to do this, we wish to adopt a participatory action research approach. Why PAR, you may ask? Well, one, we believe that this approach will help in generating knowledge about the present status of system adaptation for AFHS model implementation, while at the same time attempting to bridge the gaps and challenges identified. PAR is a good approach for health policy and systems research and is especially relevant on our research because it is designed to be integrated and participatory across all levels of the health system. And this is also one of the visions of the AFHS model in the Philippines itself. It also will allow us scope to engage key stakeholders in the design, collection of evidence, identification of issues, and development of implementable solutions to enable health system buy-in and sustainability of the interventions in general. We wish to purposefully select 6 provinces of the Philippines where the AFHS model has been implemented, and that will constitute our study setting. Our site selection will ensure adequate representation of different contexts such as urban and rural diversity, proportion of vulnerable populations, and a mix of high performing and low performing provinces on national monitoring frameworks. This is so that we not only identify gaps and challenges, but we also identify best practices that can feed into the recommendations later on. A study population will consist of a diverse network of stakeholders such as health system stakeholders, service delivery stakeholders, institutions who were involved in the AFHS model design or implementation at both regional and national levels, service users, community and social groups, as well as NGOs and the private sector. We wish to employ multiple qualitative methods to ensure rich contextualization of insights and triangulation across data sources. As with a PAR approach, data collection and analysis will be an ongoing simultaneous process to provide context and flexibility for data collection and choice of study participants. And study participants will be purposively recruited across all levels of the study population. This is to maximize diversity of opinions and ensure contextual and nuanced insights into the research question. Our data collection methods will be diverse, including but not limited to document reviews, in-depth and key informant interviews, focus group discussions, participant observations, as well as stakeholder consultation workshops. Now, this is an ambitious study, and we do foresee challenges which we wish to address right from the outset. The first being access to stakeholders and buy-in across all levels of the health system is going to be challenging. But one of the things that works in our favor is that the Ministry of Health of the Philippines has actually requested us to commission this research because they are also keen on understanding what can be improved in terms of system adaptation to ensure that the policy is implemented more effectively across the country. We do anticipate that there will be cultural and social barriers that we encounter, especially while discussing taboo topics such as adolescent pregnancies, sexual and gender based violence, among others, for which we want to ensure that we train our research team well beforehand and ensure that they tread sensitively and with respect while dealing with such topics. We will have a strong child protection policy in place to ensure that we're engaging with adolescents and young people safely, and we hope that with appropriate funding, we will be able to conduct the research over the proposed duration of 4 years with a large enough and well-staffed research team that will ensure that the intensiveness of the PAR approach and research rigor does not get diluted. And we will also provide training and reflection sessions to minimize researcher bias and promote reflexivity. In terms of ethical considerations, we acknowledge that working with communities and health systems means that we will need to have processes in place to ensure collective consent, as well as individual consent, which can be challenging while working with adolescents and minors. We also wish to ensure that we protect the confidentiality of all the participants and respondents, especially adolescents and young people, by having techniques such as anonymizing the responses and having strong confidentiality clauses built into the research process so that nobody's personal data is leaked, which can have societal repercussions as well. We wish to protect equity and justice by ensuring representation of participation in order to ensure that valuable research outcomes come out of the study that are beneficial to all. And we wish to never lose our focus on the intended societal value of this research project. I would like to end by inviting you to join us to help make adolescent well-being a priority, because today adolescent well-being is a burning global issue, and this is a great opportunity for US funders and for us as researchers to come together and join the global call for action. Thank you.